Obesity is now considered a global epidemic. Its prevalence has increased dramatically over the last few decades, affecting both adults and children, especially with urbanization. Hello everyone, I am Dr. Alan. Today we are going to talk about obesity, not just as a lifestyle issue but as a chronic medical condition. Obesity is defined as an excessive accumulation of body fat that impairs health. Clinically, we most commonly use body mass index or BMI as a screening tool. This is the WHO classification of weight. A BMI of 30 or more is classified as obesity. Remember, BMI is not perfect. It doesn't directly measure fat, but it's practical and widely used. According to recent data, the Pacific Island nation of American Samoa has the highest obesity rate in the world, with over 75% of its adult population classified as obese. At the most basic level, obesity results from an energy imbalance. Calories consumed exceed calories expended. But in real life, it's far more complex. The other causes are genetic predisposition contribute 40 to 70%, environmental factors such as sedentary lifestyle, psychological factors which can be stress and sleep deprivation, endocrine causes such as hypothyroidism, Cushing's syndrome, medications such as steroids, antipsychotics. Symptoms and clinical features. Many patients may not complain directly of obesity, but present with symptoms like weight gain, fatigue, breathlessness on exertion, excess sweating, or low self-esteem. Obesity matters because it is a major risk factor for multiple non-communicable diseases such as diabetes mellitus, hypertension, cardiovascular disease, cancer, and significantly reduces quality and length of life. The goal of obesity treatment is to not look thin. The real goal is to improve health, reduce complications like diabetes and heart disease, and help patients maintain weight loss long term. We treat obesity in a stepwise manner, starts with lifestyle changes. Medications and surgery are added only when needed, depending on the patient's BMI and health problems. Lifestyle modification can be through diet, physical activity, behavioral changes. Now, diet therapy. The basic principle of diet therapy is simple. Calories consumed should be less than calories burned. This doesn't mean starving. It means choosing balanced, nutritious meals that a person can follow for life. Now, physical activity increases calorie expenditure, improves metabolism, enhances mental health. Behavior plays a huge role in obesity. Emotional eating, stress, poor sleep, and irregular routines can all contribute. Behavioral therapy helps patients recognize and change these patterns. However, in many patients, lifestyle changes alone are not sufficient. In such cases, we move to medical or surgical treatment, depending on the severity of obesity and associated diseases. Medical therapy is when the BMI is 30 or more, or 27 or more with comorbidities, such as diabetes, hypertension, or dyslipidemia. Anti-obesity drugs can be broadly divided into three groups based on how they work: appetite suppressants, satiety enhancers, fat absorption inhibitors. Appetite and satiety drugs GLP-1 based. These drugs mimic a natural gut hormone called GLP-1. They reduce hunger, make patients feel full earlier, and delay stomach emptying. They are currently among the most effective medical treatments for obesity. Fat absorption inhibitor. Orlistat works differently. It blocks intestinal lipase, reducing fat absorption from food. So excess fat is excreted in stool. Surgical treatment or bariatric surgery include two common procedures: sleeve gastrectomy and Raux-en-Y gastric bypass. In sleeve gastrectomy, a large part of the stomach is removed, leaving a tube-like structure. This reduces food intake and also decreases hunger hormones. In gastric bypass, a small stomach pouch is created and connected directly to the small intestine. This reduces food intake and nutrient absorption. To conclude, obesity is a treatable medical disease, not a personal failure. Thank you for learning with me. If you find this helpful, like, share and subscribe to the channel, and I'll see you in the next video class.